Care to chat? Hello and welcome to this new series of the Northern Ireland Social Care Council's popular podcast, Care to Chat. I'm Wendy Austin. It's my great pleasure to host these episodes, hearing the stories of social care workers and social workers, why they're doing the job, why it's important, how to do it right, and how to take care of themselves and their clients. We'll also hear the stories of service users, some of whom now want to join the profession themselves. And that's where we are today with the story of Molly, the help she was able to access at a crucial time, the continuing support she's received, and what Molly wants to do next. With me, Molly's here today, as is Rebecca Simpson, who's support and social care worker at Belfast Central Mission, and Teresa Miles, social care manager at Belfast Central Mission as well. So great to have you all here. Welcome.
Great to be here.
So you all know each other. And you've all arrived together today. Molly, tell us, how did you meet? First Teresa and then Rebecca. Tell us about your experience.
My brother Daniel, he was working with Teresa, and then I just sort of got involved. I got pregnant at 17, so I was living with my mum at home. Started working with Teresa, got my own wee house. Teresa helped me with benefits, different bits and pieces. Really, everything. I would have been lost without you, to be fair.
So, Teresa was your first social care worker and support worker. Tell us a bit about how that worked. You say you started working with Teresa, but how did that actually work?
My brother had referred me, was it?
Yeah.
I think.
Because Molly's brother was already engaging with our service, and he had give Molly the contact details for Belfast Central Mission, so she made the online referral herself. Self-referred because she was in need of housing at the time. Her situation at home wasn't great and she wanted to move out onto her own. So then that's when the engagement started between me and yourself, didn't it?
Yeah.
So how did it all begin whenever you met up? Tell us about how that worked.
So back then I was a housing support worker for the same project that I now manage now. And when Molly referred, then we've got a certain process that we have to go through when somebody first refers to ourselves. So I had arranged to go out and meet Molly at the home. She was living at her mummy's, and I can't remember now, Molly, how many months pregnant you would have been?
About 3 or 4 maybe, was
yes, it was quite early on in
Yeah.
the pregnancy. And I suppose the difficulties then, because she was 17, was her eligibility for housing. So she needed a lot of support. You had other services involved as well that were helping you, support you to help enable you to move out onto your own with enough support. So I supported Molly with registering with the housing executive and going down all the processes. And you were offered your first home out in the countryside.
Tullysnarn.
Yeah. So initially, the advice and guidance from ourselves, we had to look at everything. She was moving out very much on her own with a new baby. So we looked at, are you going to be isolated? Or are you going to be able to manage on your own? Because she didn't drive at the time. Bus routes weren't great out there either. So, it was all that kind of practical stuff that I helped Molly with way back then. Setting up home, obviously finances were minimal at the time. So I had to look at ensuring that you were getting the right benefits and, getting everything that you were entitled to. We looked at Sure Start grants, and we done all the lovely stuff like going shopping for all the baby items and setting up the nursery, and it was lovely. It was a lovely time. And she moved into her first home just before the baby Cormac was born.
Yeah, he was born early, so it was just... I got the keys like a week before he was born, and then he was born, and then he was in the neonatal, so that gave us time to get the house ready and everything prepared. So,
So you were lucky in many ways, Molly, that you had that reference point, if you like, through your brother. I mean, I had never actually heard of a housing support worker, and that was what you were able to access. I mean, from your point of view, how much of a help was that to you?
amazing. I had never heard of BCM either until my brother was with them.
That's Belfast Central Mission.
Belfast Central Mission, yeah. Amazing. I wouldn't be where I am today without the support from them. It's just amazing. It's been great.
And how do you access that support? I mean, can you just kind of talk to them, or was that what you could do at the time? You obviously had a rapport with Teresa and were in touch with her.
If I needed anything, advice, or I just lifted the phone and contacted Teresa. She was always there.
Well, that's good to hear, isn't it? And you're kind of in charge now, Teresa. And Rebecca, who's the third part of this trio, you're now Molly's support worker, is that right?
Yeah, I am, yeah.
So tell us how you got involved and how you got into the work that you're doing now.
So I was working like a dead-end job. I was cleaning and I saw this job and I was like, do you know what? I could do that. But
And this job was?
Support worker for Belfast Central Mission. And I was like, I could do that, but it's way out of my comfort zone. Like, I don't think I could, but I could. Like, do you know what I mean? And then I applied for it, and next thing you know, I've got an interview, and I was like, whoa. And I was in work while I was doing the interview, so I had my headphones in on my phone on the screen, because it was like just after COVID. So everything was still like on the screen and Zoom and all that carry on. And I got the interview, and I was like coming out of the interview being like, what did I do there? Like, you know, I don't think that went well at all. And then next thing you know, I got a phone call. Yeah, I really loved you. Really good interview. Do you want the job? And I was like, I need to think about this. This is happening too quick. I need to think about this. But yeah, I think you phoned me on the Friday, then the Monday I phoned you back, and I was like, yep, let's go for it.
So did you know at that stage what you were going to be doing? I mean, had you heard about a support worker before?
No, didn't have a clue. Did not have a clue. I literally just looking for jobs, and I came up and I read the description. And I was like, yeah, could do that. And then, you know, you find out a little bit about in the interview, but to this job, it varies. Like, there's never a day that isn't the same, and yeah, different things all the time.
So what was it that stood out about Rebecca, Teresa?
I had been interviewing all week, actually, and I think you just know. So it was a Teams interview, it was online, and what shone through from Rebecca was her values. I just got this feeling from Rebecca, that her willingness to help. And whenever I'm interviewing people as well, I'm thinking, how would our young people engage with this person? You know, I'm thinking about them all the time. Rebecca has this lovely nature about her. She is so kind and caring. Her own life experiences, her knowledge. She is an exceptional support worker.
She's blushing at the minute.
Definitely am.
And at the time, I was only able to offer her a temporary contract, and I thought, if this girl accepted this, I would love to be able to work with her and mentor her, because I know she would be an amazing support worker through all the right training and things and the guidance. And our team, we have a fantastic team. So I thought, working alongside the team, I know that she'd be a brilliant support worker. She was only in through the door a couple of weeks, and she hit the ground running. And I had matched her up with a couple of young people, and straight away, like, the engagement levels, her connection with the young people, just her willingness to want to be able to help and support people to help improve their lives, because that's what Belfast Central Mission is all about, is helping people improve their lives in their time of need. So Rebecca, without even knowing that, was doing it, and I recognised that straight away. So then I was delighted when a permanent contract came up, and she had to go for another interview, but she done it, and she's here now permanent, so it was brilliant.
And what about that training and guidance that Teresa has mentioned there? I mean, how has that helped you to do your job, Rebecca?
Oh, I don't think I'd be able to do my job if Teresa wasn't there beside. No, but she'd even I could ring Teresa up at any point and ask her anything, and she'd give me the right guidance. And yeah, and there's loads of training opportunities. Teresa's always at us to do more training. You know, the more training we do, the better we are at our jobs. And every day you're training too. Every day you're learning. When you're out and, you know, with young people, you're learning new things every day.
Well, when you hear about the kinds of support that Molly was able to get, about benefits and housing and all of that, it's a whole kind of gamut of different things. So You need to know your stuff, don't you?
Yeah, there's very limited. I think there's very limited. When I came into this job about benefits and all, like I was kind of winging it, and I did have to research myself. But there's a lot to learn in them types of benefits and finances and all. They're changing all the time, so it's just kind of keep up with that. Know what you're doing, and yeah, just go with it.
So Molly, tell us a bit more about yourself. You have 3 wee ones now.
I do, yeah.
What age are they?
7 months, 3 and 4.
And so that's pretty full on, isn't it?
It is, yeah.
Do you still have support from Belfast Central Missions?
Oh, of course, yeah. I do.
And you get it from Rebecca now?
From Rebecca, but also Teresa as well. I can lift the phone anytime and ring both of them, so it's good.
And what sort of things can they help you with?
Just anything, benefits, housing executive. The last property that I was in was private rented. There was a lot of trouble with the property, a lot of repairs that needed done. My kids were constantly sick due to the repairs. The landlord, it was a bit of a hassle, but Rebecca had helped me with that and, took me to the housing executive and presented myself as homeless due to the landlord selling the house. So, yeah.
I suppose Molly's had a few moves, house moves since you started engaging with Belfast Central Mission. 3. She started off, you were in a housing association, accommodate property, and for some unforeseen circumstances you needed to move from there, but there wasn't a straightforward option of getting a transfer. So Molly then sourced out a private rented tenancy. At the time, we were very fortunate to have the Homeless Prevention Fund through the housing executive that we had applied for. So we were able to help and support Molly with securing a deposit for that property and living there, and then we helped her maintain it before she then decided that she wanted to move back to the town to be closer to her family. So I suppose on them occasions, that's when she did re-refer back to our service. When she re-referred back the 3rd time, that's when Rebecca had just started. And I felt that this would be a great match to pair them both up together. But Molly then was in the private rented tenancy in town, and it was in a dire state. I actually went out and visited it myself, and the damp and the mould and the tenure was just falling apart. The walls were wobbling, and we had to get environmental health out. Rebecca was fantastic with advocating on Molly's behalf.
Amazing.
To the housing executive, to environmental health, and she had organised all that. So I suppose Rebecca was just fresh out of housing rights training, so she knew what route to go down in terms of fighting various battles, I suppose, with different organisations. So,
Well, how did that make you feel? That must have been pretty good, Rebecca.
Yeah, it is. And Molly's such a joy to work with. Like, we do have the crack, like, and we do have really good rapport. But it always comes back to what Molly needs. And yeah, even just to see, like, going up there to collect Molly the day, like, and their kids in the house and them running around, like, they're in a safe house now, and they're doing real well, and
That's all thanks to you for helping me. So, thankfully.
I mean, you obviously all have a great rapport, and that must be very important, Molly. It's not always easy to ask for help, but if it's people that you get on well with, like Teresa and Rebecca and so on, does that make it easier for you?
It feels more like a friend than a support worker. So that's really good for the relationships as well. So thankfully, I'm lucky to have BCM.
And your kids must be getting to the point now where they know Rebecca and Teresa. And,
oh, yeah, definitely. We're running around this morning and they were like, oh, there's Rebecca coming. They know who they are, and they like to see Rebecca coming out to the house and visiting as well. So it's nice to see.
I love going out to Molly's to get some baby cuddles.
Whenever you went, when you applied for that job, Rebecca, and did the interview with Teresa and so on, What were you kind of hoping for? Was your intention to try to help people? Was that something you had maybe had always had at the back of your mind?
Yeah, I think I just wanted to get out there, make a difference, help people, and I didn't know really how to do that by myself. You know, I didn't know how to get out there, help people, make a difference to someone's life. Like even just one person's life, well, that's a big accomplishment. You know what I mean? And yeah, just went into it hoping to help people, and here I am, near a year and a half later, still doing it and loving it. Mm-hmm.
What's next then? When you look at Teresa there, Teresa came in at the same level as you, if I remember from when we spoke the last time, Teresa. True, and she's in charge now, so...
I don't know what's next. I'm hoping to do my MBE in health and social care, and then we'll take it from there. But yeah, I'm just really enjoying what I'm doing right now, so yeah. And
Molly, what about you now? You've got your 3 wee ones now, and you're in your early 20s, if I've done the sums properly. Yeah. You've a couple, one going to P1, one going into preschool, so a bit more time maybe. What are you going to do with yourself?
I'm not too sure yet. I would like to do something along the lines of this here. I had never actually I was doing care work in the past, but having Teresa and Rebecca and all come in, I think it seems like something I would want to do, I think. So I don't know, I'd maybe look into something like that. I think
Molly would be brilliant because she has been through the process herself and she knows kind of, the right way to go, and she had so much experience being, a client that I think she'd be a brilliant support worker. Mm-hmm.
I know, have you looked into the route? And if not, Teresa can point you in the right direction.
I haven't looked at anything yet. My wee girl's only 7 months, so
you're on maternity leave.
In due time, that will come. Yeah.
So if Molly did feel like following in your 2 footsteps, how would she go about that, Teresa?
I suppose that's one of our goals as well, is to help people with get into the route of education or employment. So that's part of like your support plans. So we could look at local colleges by starting even QCFs in the evening times. I think Rebecca's already looking at routes for Molly to go down in terms of future ambition. We always ask our service users, what's your ambition for the future? Have you a 5-year plan? So these are things that we do work together on. The joy of our project is it is very person-centred. It's all about the service users. So we take their lead, nearly in a way they're our manager, whatever they want, we can advise and support them to take that route, whatever way they want to go down.
And the route that you've taken, Rebecca, has been quite an interesting one too. You're talking now about doing additional qualifications and so on. To pick up on what Teresa was saying, what's your ambition?
Oh, my ambition? Oh, I don't know. Just to help people. Do the best I can. I don't know, be like Teresa. She's on top of the world, literally. Like, she is the best at what she does, and
there's no denying that.
Yeah.
Well, I'm not too sure about that, but we'll talk about this in your PDR. We'll look at your ambition, Rebecca. We always strive to get the best out of people. Mm-hmm. So, looking at future, the year ahead, what could Rebecca be doing to help, maximise her ability to what she's actually doing now. She's learned so much without doing any qualifications so far as such, and she'll be doing her QCF this year. But she does so much online training and face-to-face training now at the minute, in terms of training that is best needed to suit the needs of the young people at the minute. So there's quite a lot of emerging needs coming through in terms of referrals for ourselves. So we will facilitate and offer training as best we can to be able to equip the support workers to be able to provide the best possible support.
And it is interesting, the numbers of people that we've spoken to in various podcasts that we've done over the last time, who have been service users of one kind or another, and who've decided that actually that's what they would like to do. And it sounds a bit like that's the line that you're looking at now, Molly, for obviously not kind of right this minute, but for, the next year, 2 years, whatever?
I think listening to Rebecca's story, coming in, not knowing anything, and then looking where she is now, I obviously had kids really young, so I didn't go on to TAC, and I didn't get to, go and do the courses that I wanted to do. But like Teresa said, it's something that I want to work towards with the help of BCM. So hopefully I'll be on that route soon.
Well, it's been absolutely brilliant hearing from all three of you. The very best of luck, Molly.
Thank you very
your
much.
Story's a really good one, and your kids are happy, and you are in great form, it seems.
Yeah.
And Teresa and Rebecca, really nice to meet you. Thanks very much for coming along today.
Thank you.
Thank you very much.
This has been the Care to Chat podcast. If you want to hear the other episodes, you can either catch them on the Northern Ireland Social Care Council's website or wherever you get your podcasts. Don't forget to subscribe, to rate us, and of course, tell all your friends and colleagues.